It's going to start the recording. All right, we have the July Southeast NAMA chapter webinar. Whoever is on the call will start joining in. Don and I are just having some chit chat about hazardous waste, and we'll get started probably a minute after 11. I don't like to acknowledge tardiness and wait for people, but we'll make sure that we give people that extra minute to log in. And I'm going to do the housekeeping at 11 o'clock. So stand by, participants. Let me go ahead and close out some of this, the recording. I mean, I can pause it. I just have to remember to restart it. Okay, so good morning, everyone. I want to thank you today for joining us for the NAMA Southeast Chapter webinar on that pesky P list. This part's going to sound funny, but I am your host, Andrea Sturmer, and I'm also the training committee for the chapter, training committee chair. So this webinar format is going to allow you to use the Q&A section for questions that you should see at the bottom. I think I already see a question, actually. Oh, that's interesting. My email didn't have a web link for the Zoom presentation. Okay. Sorry, I was just reading, I'll address this, this glitch here in a minute. We've got 17 people on, so it looks like people are able to get on. Anyway, the Q&A is at the bottom. That's where you can put in your questions. Don is going to ask that the questions, go ahead and we're going to answer those. He's going to answer those at the end, but feel free to put those questions in while you think of them during the presentation, of course. And we'll go through them. Also, there is a raise your hand. You should see at the bottom of your screen as well, one of the functions, and Don is going to prompt the participants to raise your hand. So hopefully you can find that button before we start. The webinar is being recorded and will be available to NAMA members to log in under the NAMA member area, which is at nama.org. So just a quick couple notes regarding NAMA conferences that are coming up. And the first one is the 39th annual conference in Austin, Texas, which is in September. And that is on the front page of nama.org if you want more information about that one. And then our Southeast chapter conference is tentatively planned in May of 2025. And we're hoping to be in Citrus County. Our conferences have breakout sessions that are relevant to we have sessions and training relevant to the household hazardous waste programs and the small quantity generator programs, if you've never participated. And we have just kicked off our first training committee meeting this month, which is the committee that develops those sessions and training for the conference. So we have a lot of work to do, and the planning committee is going to start up soon, and we're always looking for people with new ideas and talent to make it a great conference. So if you're interested in participating on either or both of those committees, feel free to reach out to me. So with that said, we're going to go ahead and get started on that pesky P list. I'm going to introduce our speaker, Don Stillwell. He's with Pinellas County, Florida, SQG program, and he has worked there for over 14 years and has performed over 4,500 inspections, which is extremely impressive. Prior to that, he was a field biologist managing natural areas and studying a wide variety of plants and animals in Illinois and Florida. He's earned both his BS and his MS in biology from Northeastern Illinois University. And in his spare time, he serves as the treasurer for the nonprofit Gopher Tortoise Council. So like I said, we're going to hold questions till the end, but feel free to pop them into that Q&A. And I'm going to turn it over to Don. And go ahead and share your screen, Don.
Thank you, Andrea.
I'm going to go ahead and turn off mine.
How is that?
We can see your first slide.
Right on. Okay, welcome everybody to this Southeast Chapter webinar. Thank you all for attending. Let's jump right in. So step one, is it a solid waste? If so, step two, is it excluded from RCRA? There's 47 exclusions: household hazardous waste, domestic sewage, scrap metals, bunch of others. If it's not excluded, step three, is it characteristic or listed? The four characteristics are, and they all shouted in unison, ignitability, corrosivity, reactivity, and toxicity. And then there's four lists. The F and K lists are solvents and sludges, the Ks being from specific industrial processes. And then there's the U and the P lists. These are specific chemicals. Okay, first show of hands. Who has encountered a P-listed waste during an inspection? One or two. Okay, I would ask which ones, and I'd likely hear P001 and P075, warfarin and nicotine. Okay, so let's take P075. So why is only one of these regulated when it becomes a waste? Both have nicotine. Because there are conditions. I print out the P and the U lists, and I always have them on my clipboard. I scribble notes in the margin of my copy. Okay, to bullet point the previous slide, first of all, a waste has got to be a commercial chemical product. It has to be unused, and it has to be either be 100% pure or the sole active ingredient. So e-liquid meets this definition, while tobacco leaf has many chemicals that are active ingredients. Any seasoned inspector should know this by heart. The operative thing with P-listed wastes are you're either a VSQG on P list or you're an LQG on P list. There's really no middle ground. Okay, another show of hands, please. Who took a chemistry class some point in their academic careers? Okay, keep them up. Who liked that chemistry class? Who took more than one chemistry class? Maybe a couple of us. Okay. You're probably already comfortable with the names of some chemicals in our hazardous waste world, but many on the P list can be much more complicated. Chemistry can be intimidating. Fortunately, many of these chemicals also go by simpler trade names. The list I carry with me has both. Unfortunately, many, especially the pesticides and the pharmaceuticals, have multiple trade names. You'd have to be a savant to memorize all the permutations for both the P and the U lists. If you're unsure, a great default is to go by the CAS number. The Chemical Abstract Services number is a unique identifier in a database of reportedly over 100 million different chemical compounds. There are several online search tools. I got excited one day when I read the word brucine and something clicked in my head. It's a natural product found in the same plant as strychnine and is a very similar molecule. But upon further research, the CAS numbers don't match. So the bottle I had was actually brucine sulfate, which is not on the P list. You still want to manage it carefully, though. Conversely, the CAS number might help you to detect a synonym. Is this bottle labeled ammonium metavanadate the same as ammonium vanadate? Well, yes, the CAS numbers match. It's just a synonym. But one of the best tools around is NIH's PubChem. You can just chem geek out on their website for hours. You can search by cast number, you can search by chemical name, you can search by trade name. There's a wealth of information there. I especially find this section on use and manufacturing very illuminating. Okay, so if the P list begins with number 1 and currently ends at the number 205, why are there only 124 on the list? There's a particularly large gap between 128 and 185 or thereabouts. Well, the answer is that there are some specific toxicity criteria in the regulations. Although some of the language is gray, what's a low dose? Other criteria are more objective, like LD50s. But as you're thumbing your way through various SDS binders, words should jump out at you. Arsine is the gaseous and most toxic form of arsenic. Cyanides are chemical compounds that contain the cyano function, that is a carbon atom triple bonded to a nitrogen atom. Inorganics like sodium cyanide and potassium cyanide have the functional group available as an anion. This anion is extremely poisonous. There are no less than 13 cyanides on the P list. That's over 10%. All of these are inorganic except for P101 there. As mentioned, many cyanides are highly toxic. They basically put a stop to cellular metabolism. They're naturally occurring. You may have heard that they've been found in fruit stones of almonds and apricots. That's true. Cyanides may be found in a wide variety of settings. Over the years, I've found cyanides while inspecting several jewelry stores. I crunched some numbers out of an Excel file of almost 750 manifested hazardous waste shipments of P-listed waste in Florida between January 2022 and the end of March 2023. If you take out the LQGs, which made up over 80% of those, you're still left with 132 manifested shipments of 19 different P-listed wastes in Florida over that 15-month period by SQGs, VSQGs, and there were actually 2 HHWs in there. As you see, the 4 most common ones make up roughly 3/4 of those 132 shipments. What types of facilities generated those acute hazardous wastes? Many of the shipments were coming off LQG cruise ships, but there were a few SQG and VSQG cruise ships manifesting waste nicotine. Perhaps discarded vape pens? I don't know. We don't have cruise ships here in Pinellas County. But we are most likely to find the P-listers at these broad categories of facilities: healthcare, various labs, various manufacturing, and then some miscellaneous settings. So when I started putting this talk together, after putting the intro together, I was thinking I would just list the major industries and then start pigeonholing some specific examples. But as it turns out, many of these P-listers don't pigeonhole easily. They have multiple uses and can be encountered in multiple settings. But what I did find that really binds them all together are research labs. So these commercial chemical products are unlikely to be potential P-listeds if they become a waste. But are they really safe? If if you're using these in confined spaces at high concentrations, I mean, they can cause cancer. They can be lethal. If the mechanism of action of a product is to disrupt cellular metabolism, then it's a biocide. It's impacting non-target organisms, virtually all living things. Who's read Silent Spring? Who's read it more than once? Rachel Carson was a marine biologist in the U.S. Fish and Wildlife Service, a John Burroughs medal-winning author, and an absolute pillar of the environmental movement of the 1960s. Which pesticide comes to mind? DDT is that smaller molecule there. It's not a P lister. It's not even a U lister. Dieldrin is that larger molecule. It's also well covered in Silent Spring. It was developed in the 1940s as a alternative to DDT, and it is indeed P-listed. Operation Clean Sweep is periodically funded here in Florida. It operates on a first come, first served basis. Acceptable materials fall under our universal waste rules. So that helps facilities avoid becoming an LQG because of any P-listers. I inquired, and unfortunately, they do not keep specific records of what they collect. The Operation Clean Sweep website has, or at least had, a nice 6-page list here of potential hazardous waste pesticides. There's lots of arsenic compounds. Anyone familiar with cattle dip vats? There's thousands of these abandoned here in Florida, and the soils remain contaminated decades later. Arsenic trioxide is mentioned early on in Silent Spring. It's some of the first pesticides were actually mineral-based like this. We'll see this chemical again. Other pesticides incorporate plant-based natural products. Pesticide manufacturers mix strychnine with either peanuts or oats to make a poisonous bait. They can become LQGs through their periodic cleaning of their mixing equipment. That residue scraped off the mixing blades is unused commercial chemical product. We'll see strychnine again. Here's a use for nicotine other than in vape juice. Black leaf 40 was a very common product, and we'll see nicotine again. Now, a very few heavy hitters, these may show up as old stock at farms or greenhouses, perhaps nurseries, even landscaping companies. What about this product? It says on the label, mix with paint, kills insects. Gotta love it. So if this becomes a waste, is it a P lister? Is it a U lister? Maybe both? Actually, a commercial chemical product with 2 active ingredients cannot be either P or U listed. Remember, sole active ingredient is the phrase. New category, highly reactives. There are at least 8 that we could put in this category, with PO68 and PO78 generated very regularly by LQGs on our space coast. But P81 there, nitroglycerin, that's a shock-sensitive liquid used in construction, demolition, mining, and sometimes as a ballistic propellant. This Swedish chemist had over 350 patents to his name. And a great trivia question, dynamite was one of them. By taking nitroglycerin and incorporating an inert absorbent, it yielded a product which was much, much safer to handle. We'll see nitroglycerin again. On to manufacturing. Chemical weapons. A handful of P-listers have been used as chemical weapons. Phosgene, or COCl2, is a very simple molecule, and it's used as a chemical intermediate for various products, namely pesticides. DuPont and BASF and others still manufacture it, I believe. We previously saw arsenic trioxide as a pesticide. Now here I encountered it at a pharmaceutical manufacturing lab. We may see it again. Some pharmaceutical manufacturers are very large, like this 178,000 square foot LQG here in Pinellas County. But others, like this one, are in an unassuming 6,300 square foot building without any signage at all. That unassuming building houses a manufacturer of laboratory chemicals, standardized testing solutions, and other reagents. In their stockroom, I easily found all 8 Recra metals and essentially every other element in the periodic table from arsenic to zinc, including, drumroll please, the Holy Grail. Beryllium is the item, substance, material, chemical P-lister that started me on this quest to kind of track down as many P-listers as I could. The owner has had this container for some 25 years, and there are perhaps 50 grams left of the original 500. These are some of the standard solutions this company produces. Atomic number 4 is found in several natural minerals and when refined has this blackish silvery appearance. If either of these commercial chemical products becomes an unused waste, would they be P listed? They're both sole active ingredient, commercial grade. Well, the answer is no, because in the regulations, this unique P-listed waste is specifically defined as a powder. So only that bottle of powder I showed a few slides ago has the potential to become a P-listed waste. So now what happens when you tool any metal? What's on every floor of every job shop you've ever inspected? Tailings and dust. Now, what about these filters? Say from a machine shop in the aerospace industry tooling beryllium. Are they hazardous waste? There certainly is beryllium powder in those filters. Well, no, it's not P listed because that beryllium powder is not a commercial chemical product. So it doesn't meet that definition of P listed waste. Should this waste be carefully managed? Absolutely. It's just as toxic as if it was a commercial chemical product. Okay, on to the healthcare industry. As part of your pre-inspection research of, say, a hospital, you pull up their 8700 notification and scrutinize it. You look at the codes. You look for what kind of waste they might generate. So in the top row there, we got ignitable, corrosive, arsenic, barium, chromium, lead, mercury. Second row picks up with some more delisted, a couple more of the metals, F-listed solvent. Then we get to the P's, P001, warfarin. Then we got epinephrine, PO75, nicotine, physostigmine, and then about 10 or 12 U-listeds. But you have to take these documents with a grain of salt. I mean, they may be outdated, they may be incomplete, they may be flat out inaccurate. Here's another one. Again, we've got warfarin and nicotine, P188, physostigmine. Okay, but P112, we saw that one under rocket fuel. And P124, that's one of those numbers that was skipped over. But if any code on a list like this jumps out at you, you're going to want to inquire when you visit the facility. Do you have such and such? How much do you keep in stock? How do you use it? Does it ever spill, expire, or otherwise become a waste? Remember these labels? A plethora of codes. They basically threw everything under the sun that might be found at a healthcare facility. 16 toxics, 8 P listers, 32 U listers. One excellent reference to peruse or even take along when you're inspecting healthcare facilities is a document created by the Hillsborough County's EPC. It includes 11 P listers, 36 U listers, some Fs and some Ds. It gives examples. It's a great document. Some 20 million Americans take this pharmaceutical, and 2 million more start each year. Although it's referred to as a blood thinner, it doesn't actually thin blood. It inhibits clotting. At dosages between 1 and 10 milligrams, it's used to prevent strokes. It was approved for medicinal use in humans in 1954. And fun fact, President Eisenhower was an early recipient of this drug after having a heart attack in 1955. But it's also registered as a rodenticide in the US through a 1848 patent held by the Wisconsin Alumni Research Foundation. Paracelsus was a Swiss physician, alchemist, and philosopher, generally regarded as the father of toxicology. Translating from the German, all things are poison, and nothing is without poison. This dosage alone makes it so a thing is not a poison. That's often condensed into the adage, the dose makes the poison. Remember our old friend arsenic trioxide? First we saw it as a pesticide, then we found it in pharmaceutical manufacturing, and now here it's a commercial chemical product at a healthcare facility. It's actually an old school cancer treatment drug. While epinephrine is on the P list, this discarded EpiPen is generally not considered a P-listed waste. You can pull up these RCRA online to read the details of EPA's guidance on the matter. After finding this at an outpatient vascular clinic and discussing the finding back at work, the very next day, Kiana goes out and she finds it in 4 different formulations at a psychiatric hospital, nonetheless. So we have there a sublingual, an injectable, an IV solution, and at the bottom, a chest ointment. Well, kind of all for naught is there's an exemption. If the product no longer exhibits that characteristic that made it acutely hazardous, then it is not a hazardous waste. Nitroglycerin is listed with that little R code after it. That's for reactivity. Medicinal nitroglycerin is typically not reactive. If you drop that bottle, it's not going to explode. So it does not have this potential to become a P-listed waste. A few odds and sods you might come across at healthcare facilities. So I find myself currently rereading the Arthur Conan Doyle Sherlock Holmes stories. Sunday night, I'm reading The Sign of the Four, and he mentions strychnine not once, but twice. It was a common Victorian era medicinal, but also known as a poison. Recall, the dose makes the poison. Under the new amendment, FDA approved over the counter nicotine replacement therapies, i.e., nicotine patches, gums, lozenges, are no longer considered hazardous waste when discarded. Colleges and universities. Who's inspected a college or university? They generate lots of various regulated wastes. Manifests with 15 to 20 line items are not uncommon, but you're most likely to find P-listed waste coming from their various labs. These labs are generally full of chemicals and instrumentation. Try to talk to somebody in charge of keeping and inventorying the chemical stockroom. Universities, but also at government or private labs, always ask if they have an electron microscope because one of the common fixing agents is osmium tetroxide. A lab we recently inspected had a nice SOP covering many aspects of handling the material, including waste disposal. Osmium tetroxide. Recall my pie chart from those manifests? It was the third most common P lister coming out of SQGs and VSQGs. But this waste liquid, should it really carry a P listing? No, because it's used. This is the potential P-listed waste stored in the freezer. The crystals used to make the solution used to fix specimens. But this inorganic chemical has a long, perhaps undetermined shelf life. It almost has to become unwanted to become a true P-listed waste. So now I always ask, not only do you have an electron microscope, but did you have an electron microscope? That way, this substance might become unneeded and unwanted. Who do we have here? Sodium azide used in research. Those little students are using it to paralyze worms for chromatographic studies. A maintenance worker at a hospital was replacing a sink in a hematology lab where sodium azide was being flushed periodically. A copper pipe had dried out during the process. Azides formed in that pipe, and when he put a wrench to it, it exploded. The worker sustained serious permanent injury. But there are other departments at a college or university where you might encounter P-listed waste, like in the art department, specifically the ceramics shop, where it's used as a pigment in glazes. On the left is a legacy MSDS from a university. They no longer had this product on site. The image on the right was taken from a ceramics supply distributor. Which brings up a very valid point that commercial chemical products may be encountered at each step of the supply chain, at the manufacturer, at the distributor, at a retail outlet, or, of course, the end user. There are also labs outside of a university setting. These often have lots of chemicals too. Remember our old friend arsenic trioxide, first a pesticide, then in pharmaceutical manufacturing, then in the healthcare industry? Well, now here I find it being used as a laboratory reagent. And I found it at a USGS lab. It was being used as a growth media to study bacteria that thrive in aquifers. Same USGS lab, and here's sodium azide. When I inspected one facility in St. Pete, they happened to be in the process of a chemical cleanout, so I nosed around, of course. A lot of run-of-the-mill solvents and acids on the left, and then a cart full of old chemicals on the right. Lo and behold, poked around in there with a latex glove, obviously, and sodium azide pops up. Remember, it was the second most common on that pie chart. This St. Pete facility was actually a really, really cool inspection. Um, they make these handheld devices, largely used by law enforcement, the military, hazmat responders, and these are used to identify unknowns and to detect explosives, narcotics, chemical agents, pharmaceuticals. It turns out the devices themselves are actually manufactured in Sweden, but the calibration and the QA/QC work is done in this lab in St. Pete. They can load a library of some 15,000 chemicals into these devices, and it can ID most of those chemicals through glass. The research chemist proved to be most cooperative when I cajoled her into cross-referencing her stock of chemicals with the P list. She came up with 16, a very nice mix of explosives, pharmaceuticals, and pesticides. Most, as you can see, she stocks in very small quantities. When looking at a manifest from a chemical cleanout, you come across something like this and you say, oh my God, 10 pounds of P-list, you're an LQG. But not so fast. If you scrutinize the packing inventory, you find out that it wasn't 10 pounds generated, but only 25 grams plus 500 grams, or a little over 1 pound. They were actually only halfway to becoming an LQG. Remember, container weight does not count toward generator status. Here's another 70-pound freakout. I actually contacted the transporter to confirm the process there. Apparently, the TSDF won't take sodium azide as crystals, but requires dilution in water. Now, remember, container and packing materials don't count, but that 5 gallons, um, sorry, but that 5 gallons of water, that's 40 pounds that does count. Plus, it's treatment of a hazardous waste. So you better check with your state to see if a permit is required. At the very least, one of these should have been filed. However, if you're a VSQG in Pinellas County, there's always our business events as an option for small amounts of P-listed waste. And indeed, here's a snippet of a receipt from one of our labs. So a pound of arsenic trioxide, less than $10 to properly dispose of. They got their disposal documentation, they insured delivery, everything's square. Ah, we'll wind up with one of my all-time favorite facilities to inspect. They have lots of instrumentation, mostly gas chromatographs, mass spec. Each chemical substance will plot out a unique signal or series of spikes. They use these to identify confiscated substances or substances found at a crime scene using a catalog of these chemical profiles. So to calibrate the instrumentation, which they do monthly, they have to have the chemicals which may be encountered as potential causes of death. Strychnine. A few others, including carbon disulfide, might be used as a fumigant, pesticide, or as a building block in organic synthesis. We saw it on a manifest from an episodic cleanout from a hospital. They said it was an old laboratory standard, But my all-time favorite SDS has got to be ever. Okay, last show of hands. Who wants a polluted world? Good. None of us. Okay, so as inspectors, we are in a position to make an impact by verifying waste management practices and making sure these extremely toxic or reactive explosive wastes are managed properly. When putting together a talk like this, I always have the support of my supervisor, Catherine, and the entire business waste assessment team. Hillsborough County's EPC, Jerry, Jessica, Shannon, Kelly, they helped me find my footing when I was very new to all this hazardous waste stuff. Richard Lubinsky, fellow entomologist and HHW master, contributed many of those slides. And I reached out literally from coast to coast for anecdotes. Ross in Connecticut to Noah in Hawaii. I'd be happy to entertain any questions.
All right, Don, I think I'm back. That was an excellent presentation, extremely interesting. Definitely picked up a lot of tips, especially looking at cast numbers, and making sure that they're unused commercial chemical products when you're applying a P list. Also, the trivia was very interesting. And my favorite quote was in your presentation on toxicology. Blah, blah, blah.
Yeah.
Yeah. Anyway, we haven't had any open questions yet, but now is everyone's opportunity to go ahead and plug those questions into the Q&A. And I can also unmute your microphone if it'll be easier to have a conversation with Don on any questions. Again, the P listed can be quite complicated and you can run into difficult situations. So I know we're going to have some questions. It's the P list.
Yeah, I mean, with those three criteria, I mean, you really have to always keep those in mind. Is it a commercial chemical product? Is it unused? And is it either pure or a sole
Oh,
active
active
ingredient?
ingredient. Yes. Yes, yes, yes. All right. And we have people, it looks like from other states as well, not just in Florida. I think I see someone from Cook County, Illinois, which was
Wow.
kind of cool. I'm assuming I see Cook County and like you probably assume Chicago.
Yep, that's home for me.
Me too. We were talking about the storms. Okay, now do you want to look at the chat and just go ahead and address them, or would you like me to read them to you?
Maybe you can read them. I'm not
Okay,
that
I'm
tech
happy to do
savvy.
that. So Pamela is a copy of the Hillsborough P list available. Um, I do know that Hillsborough County EPC once put together a list of hazardous waste pharmaceuticals, and they
Y-
may have P list. Do you know? Or
Well,
Pamela, I'm gonna unmute you. Let me find you in the list here so you can maybe expand upon. Yeah, here we go. Allowed to talk. Okay, Pamela, I think you're unmuted now. If you want to go ahead and
Yeah, you had mentioned, Dawn, during your presentation about the Hillsborough had an excellent reference for the P list. So I was wondering if that was available.
again, it wasn't just P list. What it was a potential waste you can find at healthcare facilities,
Yes,
which
yes.
included many P listed and U listed aflatoxics. Yeah, again, I initially put this talk together a little over a year ago, and I believe if you reached out to EPC, they'd be happy to share that document with you.
Okay,
I
thank you.
I just unmuted Jerry Javier, who I know sometimes has meetings and stuff during these webinars, but I went ahead and unmuted you, Jerry, just in case you're available. And you can let us know if maybe that document is on the EPC website or how participants can get a hold of it. Actually, oh, there we go. Amy went ahead. Oh, she sent a link to, I think, one of the resources that Don was talking about with the PubChem. That sounded like a great resource.
It
And
really
then
is. You can search by cast number, by trade name, by chemical name.
I've always gone to the EPA consolidated list of lists for cast numbers, but that I think would be have more interesting information. We also have another question about cyanide from a name that I can't quite figure out from just the screen, what I see on the screen, but they're asking, what was cyanide used for when you discovered it in the jewelry store? I know you said there's like maybe 10 different cyanide compounds on the P list.
13. So
13, okay.
so it's actually more than 10% of all the P list of waste is some kind of cyanide. Sodium and potassium cyanide are probably the two most common. At jewelry stores, it's used in gold plating. So
Oh,
it's
interesting.
kind of in the back lab if they're doing any plating. I've also found it at a technical college, again, in the jewelry and arts and crafts kind of shop. They had cyanide there. A couple little bottles of old bottles, skull and crossbones, cyanide there.
Wow.
Unfortunately, it wasn't being stored in a very secure area. Um, but again, that's their issue.
So
But yeah,
Amy,
plating.
sorry about that. Oh yes, I definitely have seen it. Cyanide baths with plating, all sorts of coating for military. Um, and even when I was at Orange County Environmental Protection, there was a huge plater that had cyanide baths. Yeah,
Yeah,
that's a good one.
it's used in baths in very large scale. So the jewelry makers essentially do the same thing on a very, very small scale, plating.
Sorry, I was just kind of scrolling through this. Amy from Orange County, Florida, was interested in PubChem and learning how to research. Is that something that's pretty intuitive or?
Yeah, I mean, I am one of the least tech savvy persons around. If you just get on their website and just start clicking buttons, and you can navigate it pretty easily. Doesn't take a lot of training.
Good to know. I'm gonna, Amy's been nice enough to put a couple links in there for us that the participants can go ahead and click and bookmark, especially like I say, I use the consolidated list of list
Yeah.
because that will tell you if it's a RCRA hazardous waste when you're looking at a CAS number and you're looking at a list of different chemical constituents on an SDS. Um, Drew would like to know what do you use to search for SDSs? Ooh, that's a tough one. I know I tend to just Google and hope I find the right a product number.
Yeah, I basically, if I'm doing research back in the office, I'll basically just Google, but you have to be very careful that it's the exact product you saw at that facility. The facility itself, of course, should have SDSs, but a lot of those are online these days rather than in binders. And of course, the SDS binders, they're uh, frequently not updated. But yeah, if I'm searching myself, just basically a Google search. Or if you know the manufacturer, that helps a lot. I'll take a picture of a bottle of something, and if you go to the manufacturer's website, 9 times out of 10, a PDF of that SDS will be available through the website. Now, maybe 10% of the time it's not available and you've got to contact the company in order to get an SDS.
And Drew, if you I did not allow you to talk if you wanted to add anything else to your question or continue that conversation.
Sure. Yeah. Yeah. Thank you. I think that's really helpful context. I was thinking of it less from a sort of a compliance inspection standpoint and more from sort of in the vein of assistance. Sometimes we have, let's say, like a school reaching out they may not know much at all. Hopefully a container is at least labeled with some sort of information, but they don't have a paper trail on site, or sort of any online information. So yeah, I think we agree. It's complicated based on the information you have. So good to at least know that I'm not alone in that. So thanks.
I
Yeah, I
know,
mean,
I was gonna say, even some of the basic brake cleaners I still see out there are still sometimes hard to find those STSs. I definitely make a note of the product number. Because they usually, I mean, at least the cans of aerosol sprays do. I know this is not P listed. But
yeah, I mean, either take a photograph or jot down the manufacturer and the product number. And, on a lot of aerosols, the contents are written right on there. If it says, I, I came across one the other day. It had 2 ingredients, tetrachloroethylene
uh-huh,
and a propellant. So,
yep, those are the ones that are pretty high.
yeah, you don't need an SDS for that.
And Jerry did pipe in on the Q&A. He said that they're updating the website right now, but if you want to email him, Jerry, actually, if you don't mind just emailing a copy of it to me, I could go ahead and get it out to all the participants. Because I actually have that saved in my pharma folder when I'm helping facilities at North Carolina, and I've shared that document with North Carolina facilities with, a caveat that another county created this. But it was a good, and I know who did it. I think Shannon Camp originally did it, and then Jessica, I think, may have had her hands in that one too. So there's some good research that went into that document, but if Jerry can get that to me, I'll email it to all the participants that are registered for the webinar. So thank you, Jerry. Oops, I'm trying to mark that as complete. I still left the two links to the PubChem. I need to click on that PubChem. So I have it. There we go. And then the consolidated list of lists from EPA. I'm just going to leave those up in case anybody else wants to add that to their repertoire, their toolbox. I don't see any other questions. I'm just going to give a few more seconds for anybody else to drop something in. But Don, that was an excellent presentation. I thank you for putting that together and being willing to share that in a webinar format with all of our participants. So
You're welcome, Andrea. It was, once I get kind of going down a rabbit hole, it
yeah,
gets pretty deep.
yeah, you've gone definitely more detailed than I have at some of my universities and pharmaceutical. A lot of what we do, we kind of rely on the facility doing the right thing and being upfront and honest with what they're doing with their chemicals. So, but you definitely dive in and see what they have and figure out exactly what's going on. So gotta appreciate that. We have one more. We've got, let's see, Rick with Rick NE is what it said, Rick. Your whatever you just for everyone that that's listening, whatever email you use to register with for the webinar is that's where I'll get the email addresses from. So, and hopefully the one that you placed on there, Rick, will be what you registered with, and you'll get that. And if you don't get the list, like say by the end of the week or so, you can always reach out to me. I should probably put my email in there too. Let's see. I don't even know how to, I gotta click the Q&A down here. I've been reviewing everything, but not typing in anything. Do I have sorry guys. Now I'm trying to find where I can type something and I can't find it. So anyway, I'm Andrea.Sturmer at deq.nc.gov. But I think that's going to be it for the questions, Don.
Okay.
So thank you again for your time, and thank you for everyone that joined. I would be surprised if I would not be surprised if everyone had learned at least a few things today. So that's definitely an impressive content to your presentation. So thank you, Don. And everyone else, have a great rest of your day. And don't forget that you can look at this presentation again, you can reference the information and the live presentation on the nama.org website. You have to log into the member section and there's a past webinar. It does usually take me several weeks to get it published up there. But I would say by the end of the month, that should be published for reference. And if you need anything out, you can reach out to Don or myself. Thanks, everyone.